Hey everyone, and welcome back to the channel. If you have IBD, whether it's Crohn's disease or ulcerative colitis, you probably know that fatigue is one of the most frustrating and misunderstood symptoms. But why does it happen? Why do some people experience it more severely than others? And why do doctors rarely talk about it? In today's video, we're diving deep into IBD-related fatigue. We'll explore how it affects both men and women differently, the medical reasons behind it, and most importantly, what you can do to manage it. Fatigue isn't just about feeling a little tired. It's something that can completely change your life, making even simple daily tasks feel impossible. So, if you've ever felt like your exhaustion is taking over, you're not alone. Let's get started. Before we talk about the causes and solutions, let's define what we actually mean by fatigue. This isn't just about needing an extra cup of coffee in the morning. IBD-related fatigue is a deep, overwhelming exhaustion that doesn't go away with rest. It's like your body is constantly running on empty. It can affect not just your energy levels, but also your concentration, mood, and overall quality of life. Research shows that up to 86% of patients with active IBD experience significant fatigue, and remarkably, even 41% of patients in clinical remission continue to struggle with this debilitating symptom. This makes fatigue one of the most common yet under-addressed aspects of living with inflammatory bowel disease. I can sleep for 10 hours and still wake up exhausted. My brain feels foggy, like I can't focus on anything. By mid-afternoon, I feel like I've run a marathon, even if I haven't left the house. Some days, even brushing my teeth feels like climbing a mountain. Unlike normal tiredness, IBD fatigue isn't something you can just push through. It's your body telling you that something is wrong. So, what's actually causing this extreme exhaustion? It turns out there are multiple reasons, and they often overlap. Let's break it down. The biggest factor is chronic inflammation. Your immune system is in a constant battle, attacking your intestines as if they were an infection. This means your body is always in fight mode, using up massive amounts of energy. Even if you're not in an active flare, low-grade inflammation can still be present, keeping your body in a state of exhaustion. Another major cause is malabsorption. Your body depends on vitamins and minerals to produce energy, but if your intestines aren't absorbing nutrients properly, you won't have enough fuel. Some of the most common deficiencies in IBD include iron, leads to anemia, causing dizziness, weakness, and extreme tiredness. Vitamin B12, crucial for brain function and nerve health. A deficiency can cause brain fog and fatigue. Magnesium and vitamin D affect muscle function, mood, and overall energy levels. The problem? Many doctors don't regularly test for these deficiencies unless you specifically ask. If you're dealing with extreme fatigue, it's worth asking for a full blood panel to check your vitamin levels. Did you know that your gut and brain are directly connected through the vagus nerve? Inflammation in your gut sends distress signals to your brain, which can trigger fatigue, brain fog, and even depression. This is why IBD-related fatigue isn't just physical, it's mental too. Your brain feels just as exhausted as your body. Many people with IBD struggle with sleep. You might be waking up multiple times at night to use the bathroom, dealing with pain, or experiencing anxiety about your symptoms. Even if you're in bed for 8+ hours, poor sleep quality can leave you feeling like you barely slept at all. While fatigue is common for everyone with IBD, men and women experience it differently. Hormonal fluctuations, menstruation, pregnancy, menopause, can worsen symptoms. Iron deficiency anemia is more common due to menstrual blood loss. Women are more likely to experience severe fatigue, even when their IBD is in remission. Tracking your menstrual cycle can sometimes help identify patterns in fatigue levels. Testosterone levels can be affected by chronic inflammation, leading to low energy and muscle weakness. Men are less likely to seek medical advice for fatigue and may push through exhaustion instead of addressing it. If you're a man with IBD, don't ignore your fatigue. It's a real symptom, and you deserve to feel better. Unfortunately, fatigue isn't always taken seriously by doctors. Here are some things they might not tell you. Even if your gut symptoms are controlled, fatigue can persist. Studies show that approximately 40 to 50% of IBD patients in clinical remission still report significant fatigue, suggesting that inflammation markers aren't always reliable indicators of energy levels. This invisible symptom often persists long after intestinal healing has occurred. A normal iron level doesn't always mean you have enough for your body's needs. Standard ferritin tests may show normal ranges while you're still experiencing functional iron deficiency. Research indicates that optimal ferritin levels for reducing fatigue may actually be significantly higher than the minimum threshold considered normal. Steroids, immunosuppressants, and even some biologics can cause fatigue. While treating the underlying disease, these medications can disrupt your sleep patterns, alter metabolic processes, and in some cases, directly deplete energy reserves. This creates a frustrating paradox where the very treatments meant to help you feel better may temporarily make fatigue worse. Anxiety and depression can worsen fatigue, even if they aren't the main cause. The bidirectional relationship between mental health and physical symptoms creates a cycle that's difficult to break without addressing both components simultaneously. Chronic inflammation itself has been linked to changes in brain chemistry that can affect mood and energy regulation. So, what can you do to fight back against IBD-related fatigue? Here are some strategies that might help. Request blood tests for iron, B12, vitamin D, and magnesium. Research shows that up to 80% of IBD patients have at least one nutrient deficiency, with iron and B12 being particularly common due to malabsorption in the damaged intestine. Reduce screen time before bed, create a calming nighttime routine, and use relaxation techniques. Studies indicate that IBD patients are twice as likely to experience sleep disturbances compared to the general population, making deliberate sleep optimization especially important for managing fatigue. Eat nutrient-dense foods, stay hydrated, and avoid ultra-processed foods. Anti-inflammatory diets rich in omega-3 fatty acids have been shown to reduce systemic inflammation markers by up to 30% in some IBD patients, potentially addressing one of the root causes of persistent fatigue. Light activity like yoga or walking can boost energy without overexerting yourself. Clinical trials have demonstrated that even 20 minutes of gentle exercise 3 times weekly can improve energy levels by up to 25% in IBD patients through increased blood flow and mitochondrial function. Try meditation, breathing exercises, or talking to a therapist. Chronic stress increases cortisol production, which directly impacts inflammation levels and energy regulation. Mind-body interventions have been shown to reduce inflammatory markers like C-reactive protein by up to 15% in IBD patients.